this procedure, you will learn how to position and drape the patient for vaginal or pelvic examinations and Pap tests. Greet and introduce yourself to the patient.
Good morning, Jennifer. I'm Julie, Dr. Anderson's medical assistant. Before we get started, can I get your name and date of birth?
Sure. Jennifer Jansen, June 23rd.
Then confirm the patient's identity using her name and date of birth.
Great.
Sanitize your hands.
Dr. Anderson's going to be performing a Pap test today. Have you had one before?
Maybe, I'm not sure.
Determine whether the patient understands the procedure. If the patient does not, explain what to expect.
So the doctor's going to be using an instrument to take a sample of cells from your cervix. And in order for that to happen, I'm going to be helping you into certain positions for that exam.
Depending on the provider's preference, the patient may be instructed to completely undress and put on a gown so that it opens in the back, or to just undress from the waist down. If the provider also will be doing a breast examination, the patient should undress completely and put on a gown so that it opens in the front. Provide assistance as needed.
But before we do that, I'm going to have you undress and put the gown on with the opening down the back.
Sounds good, thanks.
Great, I'll give you some privacy.
Give the patient privacy while changing. Knock on the examination door before re-entering to make sure the patient has completed undressing.
Come in, I'm ready.
Hi, Jennifer. How are you doing today?
Good, thanks.
Do not place the patient in the lithotomy position until the provider is ready for that part of the examination.
We're ready to start the exam then, Julie. Could you get her into the position, please?
Sure.
Pull out the stirrups, adjust their extension length for the patient's comfort, and lock them in place. Help the patient lie face up on the table. Gently place the patient's legs in the stirrups, checking for comfort. Have the patient move toward the foot of the table with her buttocks on the bottom table edge. Some offices may stock cloth or paper stirrup covers to protect the patient and make the position more comfortable. The patient's arms can be placed alongside her body or across her chest. To provide her warmth and privacy, drape the patient diagonally with one corner of the drape between her feet. The drape should be large enough to cover the patient from the nipple line to the ankles and wide enough so the patient's thighs are not exposed. After the examination has been completed, assist the patient as needed to get off the table and get dressed.
All right, so we're done with the exam, so we can go ahead and take your feet out of the stirrups. Here you go, and you can go ahead and sit up. And let me get these out of the way for you. Do you need any help getting off the table or getting dressed?
No, I'll be fine, thank you.
Great, I'll give you some privacy.
Before cleaning the exam table, put on a pair of disposable gloves. Dispose of used examination table paper according to facility policies. To prevent the transmission of pathogens from one patient to another, use disinfectant wipes to clean the exam table and all potentially contaminated surfaces. Then dispose of your used gloves. Once the exam table is dry, pull clean paper over it. When you're finished, sanitize your hands. Follow up with the provider's orders regarding scheduling of diagnostic studies, collection of specimens, and/or scheduling of future appointments.